Hey guys, this is Dr. Hub. Today we'll look at the indications for the treatment in fibroid, that is the asymptomatic fibroid. So, in terms of the infertility, that is caused by the corneal fibroid blocking the tube, by the corneal fibroid. So, by the corneal fibroid which is blocking the tube, or a submucous fibroid causing a habitual abortions, or in terms of the submucous fibroid. So what this does is it causes the habitual abortions. Next is the indication will be in terms of any fibroid more than 12 week size. Any fibroid greater than 12 week size. And in terms of the pedunculated fibroid which can undergo the torsion. So pedunculated fibroid which undergoes the torsion. Next, in cases of the fibroid causing pressure. So the fibroid which causes the pressure, and this pressure will be on the ureter and the bladder. So pressure on the ureter as well as the bladder, and leaving a residual urine and causing a urinary infection. So it leaves a residual urine as well as causes the urinary infection. The rapidly growing fibroma in a menopausal woman. And in terms of the rapidly growing fibromyoma, so we are looking at the rapidly growing. So rapidly which increases. This is in terms of the menopausal woman, implying the impending malignancy. In terms of the menopausal woman. So in terms of the menopausal woman and implying the impending malignancy. Next is when the nature of the tumor cannot be ascertained clinically. So when it cannot be ascertained clinically, that is the laparotomy is done in such a case.